Trudy sitting in for Elias. Still looking like quite a nice day out there. But we do have that severe thunderstorm watch in effect for the region. Those thunderstorms supposed to be arriving during the afternoon. Right now, though, 24 degrees, some cloud in the sky. I want to thank the texter who reminded me from last hour that the CAQ minister who's supposed to be keeping tabs on the feelings, on the pulse of the Anglophone community isn't Christopher Skeet anymore. It is our finance minister, Eric Girard. And at 10:23, it begins in Paris. I just want to mention this because our newsroom's going to be following. French authorities have arrested a Russian-born man in Paris on suspicion of planning to destabilize the Olympics. Heavens. Our topic, this segment, COVID-19 vaccine recommendations, the new ones coming from the Committee on Immunization here in Quebec. We get all the details from Dr. Chris Labos. He's a cardiologist with a degree in epidemiology, and you know he is a regular contributor here on CJAD 800. Dr. Labos, welcome back.
Oh, hi, Trudy.
What are the current recommendations as we head toward the fall from the Committee on Immunization?
The recommendations are actually not that different from what they were last year, with one important caveat. They're sort of stressing in a way that they didn't last year that the government should wait for the updated vaccine that it's expected to come in the fall so that you roll out something that is a slightly better match for the circulating variants. And so the plan, or the loose plan at this point going forward, is likely going to be very similar to what we experienced last year, which is a fall rollout of both influenza and a COVID vaccine, both of which are now going to be updated to better reflect the circulating strains. And then some question remains about whether the RSV vaccine is going to be included in that as well. The RSV vaccine is available. It just wasn't covered by the government last year. So if you wanted it, you had to pay for it out of pocket. It wasn't an excessively large amount of money, but most people don't have a couple of $100 to burn. And so it's going to be interesting to see what the government finally decides in terms of coverage. Is it just COVID and influenza, or is it COVID, influenza, plus the RSV vaccine?
I think doctors believe that certain vulnerable groups should be getting that RSV vaccine, do they not? This is, it can be quite severe. I feel for people who get RSV because RSV put our son into the children's hospital for 3 days when he was 18 months old. It can be quite severe in little kids and also in seniors. Am I correct on that, Dr. Labos?
Yeah, that's exactly right. And I think, again, it's easy to trivialize a lot of these respiratory viruses, and trust me, many people do. But we forget that they often lead to surges of hospitalizations, mostly in the very young and the very old. But our healthcare system has limited capacity. And if our hospital beds are occupied with people who have infectious diseases, we can't use those same hospital beds and emergency room stretchers for other things like heart disease, cancer, traffic accidents, all the other things that come up. So anything that we can do to lessen the burden of diseases on our society makes a huge difference, and especially the most vulnerable groups are the ones who benefit the most from these types of interventions.
In terms of holding off on vaccination until the new strain formulation comes in the fall, I wonder if some people, particularly the vulnerable groups, people with chronic illnesses and the elderly and so on, I'm wondering if they're willing to wait, given that we are in the midst of a bit of a COVID outbreak during the warm weather right now.
Right, and that's the tricky question, and it's one I often get asked, and it's one that requires, a very nuanced and complex answer. Because had we had this conversation 2 months ago, the amount of COVID cases was actually pretty low, and holding off, would have seemed like the very reasonable thing to do. We are experiencing a summer surge now. I think many people may anecdotally know somebody who got sick, and, so COVID has not disappeared. We are seeing an uptick in cases. Not as big of a surge as we saw last winter and as we expect for next winter, but an uptick nevertheless. And so if you're a very vulnerable individual because you have an immunodeficiency or you have underlying lung disease or you have some reason, this becomes a very, very complicated calculus. And if your last vaccine was more than 6 months ago, and if your last infection was more than 6 months ago, it's not an unreasonable conversation to have, because you might need that extra protection. And if we're only expecting the vaccine to roll out in November, December, well, that's still several months away, and that wouldn't preclude you from getting the updated vaccine, let's say in January, sort of, roughly 6 months out from where we are now. So there's some very complex calculus that's going on now, which I think is what makes the situation so complicated for people, because at the beginning of the pandemic, it was very easy. Everybody go get vaccinated as soon as you get an appointment. And now it's a lot more difficult to know what the optimal strategy is, because also a lot of people have gotten sick. And if you've recently been infected with COVID, there's probably not much benefits to immediately getting a vaccine after that, because the whole point of vaccination is to boost your immune response. But if you've just been infected, your immune response is already boosted as a consequence of the infection. So that's why you constantly get these recommendations to defer vaccination if you've recently been sick.
Dr. Chris Labos, your expertise always appreciated. Thanks.
Thank you. Take care.
Dr. Chris Labos is a cardiologist with a degree in epidemiology, and you hear him regularly here on CJAD 800.